We really appreciate everyone showing up tonight. We feel this is a really important conversation to have. And we want to thank our panelists in advance here for taking the time out to teach us a little bit about pandemics and politics. While we're waiting for the next couple of minutes, I'll just explain a little bit about COIN. It is the Consolidated Oregon Indivisible Network, which is a coalition of indivisible groups from across the state of Oregon. There are over 50 groups now scattered across the entire state. And we work together to support each other, for one thing, share ideas, and we find power in numbers in doing that. And we work together on a lot of projects. One of the most common ones we've done here recently is called We Care, which started here in Jackson County, where you can see there's a couple across the Zoom screen. We basically thought it was important to let our healthcare workers know that we appreciate them. So we began showing up on Wednesdays with about 30 laundry baskets full of snacks and Gatorade and things like that to just let them know that we supported them at local hospitals. And that has now spread across the state to, I think, 8 other groups at this time. I've lost track. So that's an example of one of the things we do. And then we also try to educate each other, use these forums to educate ourselves about some of the issues going on across the state and bring people in to talk to us about these issues. So welcome. I've got 1 more minute and then we'll turn it over to Laura and Margaret. Again, if you're new and you're just joining us, please put your name and where you live in the chat box, please. If you're new to Indivisible, want to know more about us, put your email in there and we'll be happy to contact you after the meeting and tell you where your local Indivisible group is and get you connected. Okay, Laura, you want to take it away?
Thank you, Terry. For those of you as you're arriving, please continue to put your name and what group you're with in the chat, and also put any questions you have.
I can't do that.
Pardon? Put any questions that you have for our panelists in the chat. We do have the questions that you submitted when you registered, but if you have other questions or didn't get a chance to ask questions, then this is a good time to do it. So tonight, the COINversation that we have, and this is our 5th COINversation, by the way, this one will focus on the politics around the pandemic, the divisive controversies that the state and local elected leaders have had to deal with and how they're handling them. We're excited to have this panel of elected leaders, which represent
Laura, you've been muted.
Sorry.
That's okay. So we're excited to have this panel of elected leaders tonight. They represent constituents across Oregon, rural, urban, red, blue, and we're all looking for takeaways, I think, that we can use in our own communities to bring people together to control this pandemic. Before we begin, and I think we're waiting maybe for 1 or 2 other panelists, I just want to give a shout out to Dick Thompson, who is here tonight. He's a COIN member, but he was a World Health Organization spokesperson in 2003 during another coronavirus epidemic. And he's the one who coined the term SARS to describe it. Dick and Kristen Thompson and their videographer, Mary Chaffin, are also stars of many COIN videos. And you can see those on the COIN Oregon Facebook page. So do we have everybody here?
I don't think quite, but some of them may be coming from other things. You know, they also have other things going on. So we could just go ahead and start and they can join as they come in.
All right. So I will ask each panelist to introduce themselves and give as best you can in 2 minutes a description of the controversies around COVID in your community. And we'll start with Representative Dr. Maxine Waters.
I think it's Dexter. Thank you.
I apologize.
No, good evening. I'm Dr. Maxine Dexter. I'm state representative for House District 33, which is in Northwest Portland and Northeast Washington County. It's really a great pleasure to be here tonight, and thank you so much for having me. In addition to my role at the Oregon Legislature, I am and I've got my partner here behind me, sorry. I'm a critical care and pulmonary physician at Kaiser Permanente, where I take care of lung patients in my pulmonary clinic, as well as patients in the critical care ICU. This has not been an easy period, as I'm sure any of you might imagine, to be a clinician. During the 2021 legislative session, and ironically it's 7 o'clock and my neighbors are out making loud noises, which is why my dog is going crazy right now. We still celebrate and they'll be missing me in the neighborhood tonight. So during the session, I served on the House Judiciary and Healthcare Committees, as well as the chair, served as chair of the COVID-19 Healthcare Subcommittee. And through that role, I had the privilege of hearing from communities and various groups all around the state about their struggles and their questions with COVID-19. The public health actions taken due to the pandemic and our challenges to build vaccine confidence continue to be challenges. My constituents have had a bit of a different perspective and have largely been focused on the impacts of COVID-19, school closures, business restrictions, and questions about how to get the vaccine and whether masking mandates are necessary. I'm grateful for this conversation tonight, and I look forward to hearing more from everyone. Thanks.
Thank you. Dr. Trevor Phillips.
Thank you so much, Laura. It's a hard act to follow to go after State Representative Dr. Dexter. Thank you so much for everyone and all the other panelists for being here. My name is Trevor Phillips. I'm a longtime resident, husband and father that's lived in Southeast Salem for the past 13 and a half years. And I live and work here in Salem, where I serve as a Salem City Councilor, serving in my first term. And I've been working in the emergency room at Salem Hospital as well for the last 13 years. Salem Hospital is the busiest emergency room between, I believe, Seattle and San Francisco. It's by far the busiest emergency room in the state of Oregon. And we've consistently had probably the highest census of patients admitted on our inpatient side with COVID at any point in time throughout the pandemic. A lot of that has to do with the fact that our emergency room is so busy. So I've seen it, professionally. I've probably cared for, couple hundred patients with COVID, over the course of the last year and a half. And really, just the same things that Dr. Dexter had talked about. The big things is, in my opinion, vaccines are boring, mandates are boring. These are things we've always done. And just try to clearly and effectively communicate that over time has been the biggest challenge. And just to remind people how important it is to do those simple things. So thank you. I'm really happy to be here tonight.
Thank you. Dr. Gilmore.
Yes, thanks for inviting me. I'm Dave Gilmore. I'm a retired family doc from Central Point. During my career, I was health officer for the county for 15 years. I had various elected offices from school board to city council to county commissioner, which I was for a couple of terms. And since retirement, I've been working in vaccination clinics and giving shots actively for the last few months through the Asante vaccination clinic. Jackson County is kind of a unique environment, and that's kind of held us back as far as giving shots. We've got a very, very active anti-vax movement down here. It's actually centered in Ashland, liberal Ashland, and they've been opposing vaccinations for decades. That's why Ashland schools have some of the lowest childhood vaccination rates of any schools in the whole state because of this group. We also have some sort of far right-wing conservative groups, including some, there's one, the Southern Oregon Constitutional Guard, which is considered a hate group. And that's actually, they've had some discussions with a number of our county commissioners over the years, influenced them. I was the last Democrat as a county commissioner in Jackson County. In the last 11 years, it's all been Republicans, getting more and more right wing, with the most prominent Republican, a former Tea Party person, who actually a couple of months after COVID started in our valley, led a rally in front of the courthouse with hundreds of people. They're unmasked and bunched together, protesting masking and social distancing. And she's also led efforts to have various proclamations over the last few months decrying the mandates. So it's a difficult environment to work in for many of our staff. So it's not the situation you have up north. And because of that, Jackson County consistently now is about 8% fewer vaccinations, both for fully vaccinated and partially vaccinated, as the rest of the state. So we kind of fell behind on that. So it's a different environment from what you're seeing up north.
Thank you, Dr. Gilmore. Marcus LeGrand, we got started as you were coming in, and I just wanted to let you know we're asking each of the panelists to introduce themselves and give a brief description of the controversies around COVID in your community. You need to unmute.
Thank you about that. Sorry about my tardiness. I was coming from another board meeting that I had to do today. But
No
my name is Marcus LeGrand. I am newly elected here to the Midland Pines School Board. And some of the concerns and issues that we've had is that we've had a group of parents or a small minority of people who have basically tried to fight not only the mask mandate, but tried to make it really, really hard for us to try to get some things done. In conjunction with that, many of them have also attacked many of the BIPOC board members here in Central Oregon. So it's been really hard to try to focus sometimes on some of the many things that we're trying to get done. Just to also give you a little bit more about my background, I actually work for Central Oregon Community College, where I serve as a representative helping to find resources for students to be able to attend the college, as well as an instructor there. And I serve on the board of the Fathers Group here, which is a local nonprofit that helps provide resources for the community, the BIPOC community. So just want to give you an understanding of what I do here as well. So it's been really difficult in some ways because you have a lot of people who are pushing back on a lot of what we're trying to do. With the October 18th deadline, we actually had about over 95% of our teachers and instructors or in staff actually get vaccinated, which is tremendous. And I think that's a detriment, not a detriment, excuse me, I think that's applaud the efforts of not only our board, but the superintendent and his staff to be able to get a lot of those things done. So overall, there's a few things that are going on, but at the same time too, I think we're still pushing forward to try to make sure we can get things done.
Thank you. Kathy Schwartz.
Hi, everybody. Sorry, I had a little trouble getting connected tonight.
That's okay. Thank you for coming.
Yeah, of course.
Welcome.
Yeah, thank you. It's nice to see some familiar faces out there. Hi, Bev. So I am a county commissioner for Wasco County, and I've been in the job for 3 years, thanks to Bev and Debbie Farrar, thanks to our local Indivisible group, I will say. And Wasco County, if you don't know, if you know where the Dalles is, that's pretty much the center of, or the central community of the county, but it's a very rural county for the most part. And I am, by background, a registered nurse. I'm also have a master's in public health administration, and I used to be a public health director. So, you know, when COVID hit, it's kind of right up my alley, I guess, but that's another story we'll get to later. Just for context, when we talk a little bit more about my county, we have a very unique health district here. We're the only health district in the state of Oregon. Every other health department is under a county governing body, our county commissioners. We have a 3-county health district. It's a non-taxing district, but it's actually run by a board of citizens as well as 1 county commissioner from each of the 3 counties. And the counties are Wasco, which is where I am, Sherman, which is a very small county, about 1,800 people, and Gilmour, which has about 1,200 people. And I am currently chair of that health district board. So some controversies around COVID, we really have been quite fortunate that we haven't had any major controversies. I heard some of the other panel speakers talk about some of the things that are happening in their counties. We're just not seeing that, but we're having the usual what's happening all over the country. Our vaccination rates are very slow. When you get out into Gilmour County, which is really rural, they're only in the 40 percentiles, you know, vaccination rate. Sherman County lagging in the 60s, and Wasco County just now inching up into the 70%. So same challenges, very rural counties, very susceptible to misinformation, conservative viewpoints around COVID. And I guess I'll just say one more thing around from where I sit. Probably the most difficult thing, even though as a board in Wasco County, we've pretty much towed the line as a 3 county commissioners. We've gotten a lot of pressure from Eastern and Southern Oregon county commissioners to write resolutions, to send letters to the governor, pushing back on the governor's mandates and executive orders, just flooding in. But fortunately, none of us have taken the bait, and it's not come to even to the public forum for a discussion. So I'll leave it at that. Thank you.
Thank you very much. So I'm just going to dive right in. These are questions that we received from people who registered here. Hopefully you'll recognize your question, but if you don't, it may be because we took 1 or 2 questions and combined them to try to get at the same idea. So for each panelist, what steps did your communities take that worked well in addressing the pandemic? And what problems came up that you did not anticipate? Some of you have alluded to this, and maybe you could expand upon that. And I'll start this time with Dr. Gilmore.
Yes, thank you. Yeah, fortunately in our county, the weakness of our commissioners has been kind of counterbalanced by having a very effective and very smart county administrator. When we early on in the pandemic, we had this terrible fire go through our valley, the Alameda fire, which basically made 5,000 people homeless overnight. They were crowded into Jackson County Expo Park, which is our fairgrounds. And the county was so well organized, brought National Guard and other people in. They were able to almost immediately shelter those people and get them fed, kept them spread out as far as they could, get them masked and so on. And then as quickly as possible, get family units into hotel rooms so they could do some more isolation there, which was remarkable how quickly that happened. Unfortunately, there's a lot of motel rooms available because of all the lockdowns and no tourism. So that was something they could do. But that model kind of held through, so that when they started vaccination about 4 or 5 months later, they had a vaccination clinic to get that first round of people getting vaccinated, and they got 5,000 people vaccinated in 2 days, which was quite remarkable. And they were ready to do more, but then the state killed it. And this is something that really set us back, because what happened there, because we were doing everything was going so smoothly, that we kind of got ahead of the program. We got that first round of people that were supposed to get vaccinated, ready to go to the next round. And they say, wait a minute, Portland's way behind you. We'll shift vaccine up there. So they basically took thousands of doses of vaccine, dumped them into Portland, never told us when we were going to get any more vaccine. So things stalled for weeks and weeks and weeks. And what that did is it kind of hardened the antagonism of our county commissioners, who were a bit antagonistic to start with, but that really kind of set them off and made it very, very difficult from there on. Now we were able to get further vaccination clinics down at Expo, but they were at a slower pace. They, again, to get National Guard in, we got during the next round about 28,000 people vaccinated over a couple months, but it wasn't quite the pace they did initially. And that's because of this sort of reversal we had. So that's kind of where we were on that one.
Okay, Kathy Schwartz.
Sure. I think what worked well, has worked very well in our county, is we have a very strong health officer. And right away, the district hired her full time. Generally, I don't mean to speak for, certainly in my experience, health officers, especially in the smaller counties, tend to be very part-time. They tend to be retired physicians. They're not epidemiologists by any, but anyway, they really aren't epidemiologists. And we happen to have, we made her full-time. It was science-based, factual, not dramatic, very kind, very poised. And what we had her do was come and speak to us every 2 weeks at every board meeting. And to this day, they are first up as a presentation to our board on what's happening with COVID in the counties. And I think that's been very effective to really having the other commissioners be really understanding this epidemic and what it means, and having them able to ask their questions. I mean, obviously, I come from a background where I understood all this stuff, but they don't. And I think it was very, very effective for sure. So I don't know, what was the other part of the question?
Was there anything that came up that y'all did not anticipate?
I think just like everyone else, just the reluctance to get the vaccine, that was really a shocker to all of us. It's like, what? You know, how could that be? I think one thing we dealt with as a health district and as a board was restaurants opening that weren't supposed to, but we're a small county. These are people that live down the street from us, for instance, and here they are opening a restaurant. And, you know, the health district wasn't really used to being that enforcement agent for OSHA. And that was rather unexpected and very stressful for our environmental health folks to have to intervene in those areas, and people were not happy with them. And just as I mentioned, we're a district, not a health department. So some of those funding streams came into the county and not to the district. So there was some issues there that we weren't expecting on how to, you know, what was for the county, what was for the district.
You mean in terms of the vaccine funding?
I think just funding, COVID funding streams from the state and the feds. Yeah, that wasn't quite expected, how to maneuver where those funds should go. But we worked it out. And I think, yeah, I think for the most part, our board has functioned very well and continues to.
Okay. Representative Dexter, I don't want to confuse you again with my favorite congressional representative, and I apologize for that, but could you?
I will, please, and Laura, I will never, ever take offense to being called vaccine water, so okay. Thank you. So things that worked really well in my community really depends on which group I'm referring to. So in the hospital, I think one of the best things that has happened is we've really leaned on each other and supported each other. Since the very first patient, my group was the group that diagnosed the first patient with COVID-19 in the state of Oregon. And, you know, we immediately had to understand and iterate how to respond and what precautions were necessary. So from the very beginning, our teams have worked really well together and have had different ways within our system. I'm so sorry, to continue to do improvements on that. Throughout the pandemic, I felt grateful. Hey, Rob, sorry. Throughout the pandemic, I've really felt grateful for my community and the steps that everyone has been taking to ensure the safety of one another. Sorry, oh my God, it's the reality of having a family. I felt that my work in the hospital and the effort it continues to take has been valued by neighbors. You heard them out there still celebrating at 7. And my family has really been supportive. My husband's also a primary care doc, and we have really felt that this has sustained us in a way that I didn't appreciate at the beginning, and now as things have really gotten hard, I'm losing a lot of young people and their families, and the resilience of my neighbors and the support of my family and friends has really been key. In the hospital, we are struggling. We are going on 2 years of endless demands and an overstressed system. What has worked well is, as I said, connecting with team members and pulling together to do all we can. But it is taking a toll, just to be really candid. We are losing workers, and we are feeling more and more frustrated by the preventable illness and death that we are seeing. The challenge of working so hard when we have a safe and effective way to end this pandemic, or at least dramatically decrease it, and yet we're not embracing that as an option as a society is really hard on a lot of us. And the biggest issue that I did not anticipate was the sudden distrust in science and the hesitancy of the legislature, executive branch, and others to act preemptively against the threat that was posed. You know, it's not a criticism. Even as we're sitting here talking about vaccine passports and mandates, I feel very strongly the pushback from members of my community. So it's not without a lot of challenges, but I am surprised by how hard it's been to take pretty standard public health efforts and initiatives to move forward as leaders. Thanks.
Could you elaborate a little on what you meant by what preemptive action you think the legislature could have taken that surprised you they didn't do?
You know, I think preemptively we could have standardized vaccine mandates. We could have standardized vaccine passports. You know, at the school level, we've really deferred to the OHA, and I think that's absolutely appropriate. So I'm not saying that what has happened is inappropriate. I'm just honestly surprised because a lot of us, you know, I did a public health epi sort of degree and didn't finish my master's. And, you know, things that are pretty straightforward if you come from a public health training, just the misinformation that's undermining people's trust in those guidances has led us to not be as proactive as I think we would have been otherwise. So it's, again, it's, and I intubate people who honestly didn't believe COVID was real until they were being put on a ventilator. So I don't believe anyone is doing this as nobody's refusing a vaccine because they want to be harmed or to get ill. I think they really believe they're making the best decision that they can based on the information they have. So if everyone were dealing with the same information, we would be in a very different place. And unfortunately, that's just not reality right now.
Thank you. Dr. Phillips, you want to weigh in on that?
Yeah, I mean, I'm so grateful for the other panelists being here tonight, especially, you know, Representative Dr. Dexter and the work that she's done to take those important, to spearhead taking those important preemptive steps. I think we're in such a better place because of, you know, the letter that you got going, you know, 2 years ago. I can't imagine where we'd be without that. So, you know, again, thank you for everything you've done. You know, it's easier to build on the work of others, you know, when we're not going it alone. You know, I think that things that have worked well locally is, you know, building relationships and, you know, working within the community that you have. I know that, you know, Salem Health worked with the state fairgrounds and the National Guard to staff the vaccination effort early in the pandemic. I think to a lesser extent, we were slowed down, as mentioned by Dr. Gilmore, because we got a little bit ahead. It also correlated with the same time as the ice storms that happened. So some of it was outside of everybody's control. There was just a decrease in supply temporarily. But really, you know, people kind of came together and they were willing to work kind of across political views early on. And then as we got into summertime, as the numbers got down and the fear kind of started to go away, I was a little bit surprised that we kind of took our foot off the gas or the brakes, however you want to look at it, in terms of letting up on some of the masking. I mean, I think that people were clamoring for it outside of my own political worldview, and the pressure became kind of unavoidable. I think we all hoped that Delta wouldn't be as bad as it ended up being. So, you know, I think that I am not as surprised by the distrust of expertise. I mean, I'm very disappointed that that's the reality we all exist in, but the distrust of science and the distrust of expertise doesn't really surprise me after the last 5 years. But how quickly the reality of the Delta strain coming back and coming back worse than the winter surge, really, I mean, just being able to rely on, you know, the relationships and friendships I've developed with local leaders like State Senator Deb Patterson, knowing that I could call her when I was genuinely scared because of how many COVID patients we were seeing in the emergency room at Salem Hospital. And just that line of, you know, the exponential increase and knowing that there was a real chance the system could be truly overwhelmed, which I don't think we ever were, but we got kind of close. And, just knowing that I could call her and, a day and a half later, thanks to the work, through Multnomah County and other, state leaders like Dr. Dexter, and then we could go back to a mask mandate indoors and quickly thereafter outdoors, and move forward on getting vaccine mandates. I'm so grateful to see the flattening of the curve that we did with that work. So just, yeah, thank you.
You said, I just want to ask you briefly, you said that you were not really surprised by the vaccine hesitancy or the distrust of science after the last 5 years. Was there anything that you think in your area or the state could have done to prepare for that, given the climate of the last 5 years?
I mean, I think that people are just, it's such a difficult question to answer. I don't know that there is. I think we're all struggling to deal with it, on the various hats that we hold. I mean, as a city councilor, we don't really, the city of Salem doesn't have as much to do with public health. That's more a purview of, the local county commissioners here. But I think just communicating clearly, supporting other people, finding people's background, that really do understand and trust just the reality of, the scientific method and how it works is so important in getting people, elected to positions and supporting people who understand that. But yeah, I think I lost track again. Can you remind me what the question was?
Well, it just seems that I think we all thought that when a vaccine would come along, everybody would want that. Both sides seem to be looking for that and wanting that. And many have expressed surprise that there was such vaccine hesitancy.
Yeah.
And you said you were not as surprised given the climate of the last 5 years. And I just wondered if there's anything that you thought we should have been better prepared for in that respect.
I think it's difficult. I mean, we've all learned. I don't know that we could have been. And some of my understanding might have been unique to being, here in the state capitol, and talking to, state leaders who were kind of impressed, for lack of a better term, by the organizational ability of kind of the anti-vaccine movement, even prior to 2 years ago. I mean, there were efforts to, make vaccination even better uptake before the pandemic. And you had, like 1,000 people at the state capitol, which sounds like a lot, but there are many political organizations who've done that. But it did kind of, at times stall things that could have maybe made a difference earlier on. I think that what I've seen change is that, my colleagues who are much more, apolitical, they don't want to be involved in that side. It's hard enough to be a doctor at this time or a nurse at this time. We're all just a lot less scared to speak up. So people are much more, straightforward, and I think they're getting involved. So I hope that will make a difference.
Okay. Marcus.
Yes, just like many of the panelists who've spoken already, we did a lot of things similar. We did clinics for our students and their families to be more informed. We'd make sure that we bring the National Guard in to be able to help with the county to be able to distribute the vaccines. But I think the worst part of this whole pandemic is that the pandemic itself was politicized, and that's unfortunate. I think that's the most critical piece of this. And then I think that's what divided a lot of us, and they realize this is more human rights than anything else, right? And I think that was the mismessaging, the misinformation has really, really hurt what has happened in terms of trying to make sure that people get the right information. I think if we would have had better leadership, not just from the top, but from many different facets across our country, who would have been leaders and were willing to govern and put the right information out, I think it'd have been more. I think we'd have got more people vaccinated in the beginning. I think the information would have went out. I think if we would have been able to, people would have stepped up and handled their responsibilities and spoke up earlier. I think a lot of this would have helped a lot of the issues that we have had over the pandemic. Now, the one thing I want to definitely talk about more of is that how it's impacted the Black and Brown community here in not only in Oregon, but across the country. It has really decimated a lot of those communities because many of them don't have hospitals within their areas. Many of them don't have the clinics. Many of them don't have the resources to be able to get many of the things that they need. I look at what is done to the Warp Spring tribe, the Klamath tribes here. Also, what is done to many of the Black and Brown everyday workers in Central Oregon and around Oregon as well. And those numbers are super high. And unfortunately, they didn't start putting those numbers out till later into the pandemic. And I think that's a disservice, not only to those families, but the community at large. So the thing for me is I think what we need to start concentrating on is not what we happened in the past. We know the pandemic's here and COVID's probably not going anywhere. We're going to have to start looking at what we need to do for the future. What can we do to prepare to start getting things ready for what we're going to need, be able to continue to educate our kids, to be able to figure out what resources they're going to need, and also help them come up with the mental health concerns that they have currently. Because many of these students are suffering. As we know, suicide rates our attempts are up. Students having the willingness to have the mental capacity to be able to get through schools right now is tough, as well as trying to find the way to be able to educate them on the science portion behind this, so they're fully informed, so they can definitely make decisions and be able to help their own families make decisions when these things happen.
Okay, thank you. Kathy, I want to direct this to you, and to start with you. You alluded to how cooperative your commission worked, especially with the information that was provided by your science-based health officer. What would you say was most effective in influencing your fellow commissioners and also the community members who did not agree with the policies to control the pandemic?
I'm not sure that we have convinced the community members, given our, vaccination rates. But as far as my colleagues, again, I think it was really the strength of our health officer, and there's relationship building. I think one of the other panelists mentioned that and how powerful that is. And our board, our other commissioners developed a relationship with the health officer. One of the commissioners, especially, he and I developed a relationship that we didn't have before, because we had this common ground around COVID, and he was very, very interested about the epidemiology of COVID, and he'd read articles and then he would call me and say, what does this mean? And so we had an ongoing dialogue about this, and that strengthened our relationship, which I think has spilled over into other issues that we've been aligned on. So but I did want to mention one other thing that surprised me that I didn't mention earlier about the COVID response. And that was all of what I call the armchair epidemiologists that we dealt with. And I want to call out, the representatives and senators that I have in my districts are constantly pushing back against the governor and saying things like, well, we should be opening this and that right now. And, it's like, I would question them and say, well, what science are you using to make these statements? Because this really isn't helping, our cause out here. And that was surprising to me, to be honest. That was another very surprising thing that we had to deal with out here. And I think that's one I took on myself personally with these guys. My colleagues probably did not choose to do that.
And how did you deal with that? How did you push back and educate members of the community that vaccines and masks were preferable to ivermectin and natural?
Oh, well, I think, when I'm talking about the representatives and state senators, I whenever they would be in doing a town hall or something, or a community gathering of sorts that I could attend, I would simply ask them, well, what science are you using to make this statement? And there would be community members there. And I don't want to leave the impression that our state reps or senator are talking about ivermectin or any of those things. It was all pushing against the governor's mandates whenever there was an opportunity. And I would just ask the question, by what methodology, what science, what epidemiology do you understand to actually make those statements?
Okay. Thank you. Marcus, what would you say was effective in influencing, or has been effective in influencing, your fellow board members and community members who didn't agree with the policies to control the pandemic?
Well, many of our board members here at the school board actually really took the time to realize that we knew that we were going to need clarification on things. And people were willing to actually have those hard conversations that most of the time people wouldn't have. If you know, most of our board is pretty diverse in their mindsets about things they wanted to accomplish within this. So they knew that we were trying to protect the rights of the people. And I think that was the most critical piece. The other thing they wanted to do is they wanted to make sure that whatever messaging we put out, we wanted to make sure that it was informed and it was just something we didn't do we didn't fly off the seat of our pants. I think we did also a great job of making sure that any feedback we got, we made sure we answered every message that we got that came in. We tried to make sure we had a unified message that went out. So we really didn't have much pushback from our board. Everyone really took the time to make sure they were informed, and I think we did a great job of making sure we got the right information out.
What about with the community? What would you say was most effective in influencing parents and other members of the community?
Because I think oh, okay, great, thank you. I think what we did is we put clinics in the parking lots of all our campuses. So the parents could basically do their own research working with the healthcare workers to make sure things got done. I think the other thing we did really well is that we put out a letter to parents if they had a concern. Here's the steps you can take. Anytime a parent who did have a concern, they could go to their administrator, or they could go to the person they had on site to be able to talk to them about it. Also, we hired more people in terms to handle the mental health portion of this. So if people had concerns, those parents could go to those people too. So we put a really good team in place to make sure that happened. So like I said, I thought we did a really good job of trying to commandeer many of the things that were coming down the pipe.
Okay, thank you. Dr. Gilmore, same question. What do you think was most effective in?
Actually, nothing. I'll elaborate on that a bit. I think because of the leadership vacuum of the Board of Commissioners, I mean, our health officer came up the plate, and he had almost daily interviews with the media. The physician community came up the plate, and they had a petition urging the commissioners to take a more active role that was signed by almost 500 physicians in the Valley, which is pretty close to 90–95% of physicians. That's quite remarkable. The hospitals came up the plate. The hospitals basically told the commissioners, no matter what kind of resolution they were going to do, they're going to follow the mandates, which they did. And so I think that we had people coming forward, realizing that the nonsense out there has to be overcome. We couldn't rely on our political representatives. That includes even Jeff Golden, the Democratic senator from Ashland, who, for reasons that aren't known, has opposed the mandates and has been influenced by the anti-vaxxers in Ashland. So, most of the medical community has felt kind of abandoned and had to come up and do their own thing. The hospital has been very effective at that. Our hospital is probably closer to collapse than most hospitals in the state. People don't realize how close we were. There was a stretch in September, we had the most rapid increase of COVID in the country, our county, which is just remarkable. And the hospital is just totally overwhelmed to the point that you had virtually all the family docs and internists who had staff privileges were manning ICU beds. The medical ward at Three Rivers Hospital in Grants Pass was being manned by orthopedic surgeons because they didn't have any people with the medical training to do that, because orthopedic surgeons were doing surgery and they had to bring in bodies to be able to manage that ward. And that's absolutely catastrophic to get to that stage. But fortunately, we got over the spike, and now the cases are coming down. But our staff were remarkable at what they did and how they improvised along the way. And right now, Asante Hospital itself is backed up over 1,000 cases for procedures and surgeries. 1,000 in just our area. That's a huge number that they're going to have to accommodate as the spike comes down and as staffing improves. So it left us in a pretty bad position. But let's really give credit to the physicians and staff members in our community and how they came forward, regardless of the political side of it.
Well, given the political vacuum that you had there, what was effective in reaching members of the community to come forward and get vaccinated and wear masks? those that may not have agreed with those policies?
It was just, for the most part, it was physicians talking to their patients and urging them to come in. And we had just an overwhelming number of physicians. When I was working at the vaccination clinic, we had a lot of people coming in. I said, well, what's that here? Well, my doctor told me to come in, and then he told, I was a little bit reluctant. He talked with me and convinced me it was the right thing to do. So that really had a big impact, despite what was going on politically.
Thank you. Representative Dexter.
Thank you. And I will agree that when we say what was most effective, I'm still looking for that. And to Dr. Gilmour's point, by far the most effective thing is the one-on-one conversations. As a physician, we are trained to make a connection and establish trust with people who we don't agree with or share ideologies with. And that I'm very comfortable with, and I have had many patients who have changed their minds based on a conversation. On a population level, as an elected state leader, that kind of one-on-one engagement just simply isn't possible, especially at this point in time where so many people are having misinformed conversations with people they trust. And so it really is the endless misinformation wall that we're fighting against, trying to overcome and get to a point of trust. And so I'm really struggling because I'm seeing some of the comments and hearing some of the things that people think are so obvious, that we've done a bad job, that we haven't been, we haven't been forceful enough or definitive enough. And what I will tell you is that there is an enormous public mobilization that the anti-vaccine and different groups have established. And as an elected leader, you are accountable to the people who you represent. And when the voices that you hear enormously outweigh those that you believe, that is like, it is gaslighting. We do start doubting our own instincts. We start wondering if people don't want to follow what we know is right. And I've had death threats, and people, like, we have to get escorted places because we really are fearful for our safety at this point in the Capitol and in different areas. My home has had to have safety precautions taken because I was so outspoken about public health measures. And that gets to you after time. And so if there's one thing I can say, I know that Indivisible is full of people who believe science and who listen to data, and we need to hear from you more. We need mobilization of rational human beings. It's easy to sit in a place where you understand your reality, but it is not the reality that is shared with a huge proportion of our state. And that is the fundamental problem that I haven't figured out yet how to overcome. And hopefully I don't sound too emotional, but this is what's taking a toll. The disconnect that I see with the people that I am taking care of, the 52-year-old who died, and I had to tell his children that he wasn't coming home. He wasn't vaccinated, and he wasn't trying to hurt himself. He wasn't trying to hurt his family. He really believed that he made the right decision. And then being told, that I need to be taken with a noose out because I believe that vaccination mandates are important public health measures. The disconnect is so surreal and so confounding that I'm sorry, I'll just stop talking, but this is the fundamental problem, I think, right now.
Thank you. Dr. Phillips, you were nodding your head. Did you have anything to add to that, or?
I mean, I sympathize with everything that Representative Dr. Dexter just said, and I'm so sorry you had to go through that, and I'm incredibly grateful for your leadership. I know it made a difference in my practice and for the patients and community members that I care for. It's abhorrent that you had to go through that. The gaslighting is real, and I guess that is surprising. Like, there's a for-profit system in this country that I don't know if they make money off of it by entertainment or just further concentrating wealth, but the people are making money saying these nonsense. There are a few, 100, maybe 1,000 bad actors that are just vacuuming up lots of money to do this. So, it's difficult for all of us to push back against that backdrop since we're not funded. We have to do this through just, sweat equity and shoe leather, going door to door and making phone calls to get, better or different people elected to make those important decisions. So, earlier I said the rapidity with which the Delta variant, came to be here was surprising. I would say that the disinformation campaign that has killed people was also surprising, and it's been very challenging to push back against.
I want to switch and ask you about how all of this has affected your ability to do your other work. And I'll start with Marcus on that. How have the controversies with the school board, and you alluded to racial tension and having to implement the lockdowns, the masks, how has that affected your ability to do your work as a school board member?
What it does is slows down the process, because when we're actually trying to do concrete work to set foundations, like create policies, procedures. Let's give you a quick backdrop. We didn't have a superintendent in our school district before this all started, so we had to hire one before this. After this, when we went into the pandemic, we finally made that happen. And then finally, think about it, many of our school board members were only on the board maybe 2 or 3 years, and we now have 4 new members on the board. So we're all new, trying to get this correct and do the right thing. And it's hard to do work when you have a protest out front, or you have Turning Point putting out this blasphemous stuff about all the BIPOC members of our board, and then people filing formal complaints against only the BIPOC members of our organization or the board. It is very, very hard because you're trying to do work. But what we did is we put some things in place. For instance, we only are meeting in via Zoom right now for public comment. We don't let the public in. We are trying to make sure that we can have work sessions and retreats to be able to commandeer some of those things. But what we do is we try to find ways to support and figure out who these people are. We try to call them out. And we also have the opportunity to also utilize the resources we do have, our lawyers, FBI, whoever needs to get engaged to try to really make sure that these people don't have a leg to stand on when it comes to these things, because many of these complaints and stuff are frivolous, and they know it. And it's just there to just trying to stop us from being able to get anything done. And that's unfortunate. But here's what we think. We think if we continue to support each other, we continue to keep speaking up and speaking out, but at the same time, get the work done and put policies, procedures in place, they don't have a leg to stand on when it comes to various things. So we're taking this as an opportunity to galvanize and work together and push hard to make sure that we don't listen to the rhetoric. We don't listen to these people who don't have our children and our community at large best interest at hand. So we're working hard to, like I said, to make sure that we don't listen to the noise.
Has this impacted it must have, the education of children? There was a question in the program about programs had been closed down. Someone had a child with developmental disabilities who had a day program that was closed, and was wondering if it would ever be reopened. And I assume that's the experience of many districts, that programs have been interrupted, canceled. Can you comment on that?
Yes, some of those programs unfortunately had to not continue fully because we can't get the total support, because a lot of those programs are functional on volunteers. So we can't have a lot of volunteers, just like a lot of the hospitals can't have volunteers or visitors. So that hurts it. Also, not being able to have people to be able to do certain jobs, like faculty and staff, like, the classified jobs. We can't fill some of those jobs. Bus transportation is hard too, because we don't have the transportation to be able to do those. So parents will have to be the people that do that. But then also many of those parents had to go back to work. So it made it hard to be able to fill some of those programs too. And then finally, some parents made a decision to homeschool their kids, and being able to not have those resources that they normally would have has been tough for them as well. And also, if you don't know anything about Central Oregon, childcare is probably one of the biggest opportunities for us to be able to have any community engagement, and a lot of them had to close. So finding childcare is really hard right now, and we're trying to find ways to be able to accommodate those parents, to be able to help them with after-school offerings, to facilitate other means to be able, or cohorts or whatever with the community, to be able to make sure that happens. So it's really, really tough right now here in terms of looking at trying to continue certain programs.
I wanted to ask you all, I wanted to take some questions in the chat, but I wanted to ask all of you about the governor's vaccination requirement that went into effect Monday, and for many healthcare workers and state workers. And I guess the rest will go into effect November 30th. Do you think this requirement has increased vaccinations? And can you comment about how it has affected healthcare and the government agencies in your area in terms of staffing and functionality? Kathy Schwartz.
Yeah, sure. I think it's definitely increased our vaccination rates. We've seen ours go up recently. I think that's happening nationally with the federal mandate for healthcare workers. So I think that's a no-brainer for sure. It's not clear whether it's going to affect counties that employ more than 100 employees yet. We're still waiting to get Oregon OSHA rules on that. But there's a lot of drama, in the county. A lot of, well, you can imagine if that happens here, we're going to quit. Our whole sheriff's department's going to, leave. Our facilities department, our road department are going to walk out. And, I'm kind of, well, I know we have some physicians on this call, and I'm a nurse, and I worked a lot in hospital management and change management and worked with a lot of physicians. And I had this saying of, of course, listen to what they say, but watch what they do. And I think this is true with these mandates as well. I mean, are people really going to walk away from these really good jobs? They've got mortgages, they've got, food they've got to put on the table. And I think we're still in a wait and see mode. But I do think the mandates are working, and I'm all in favor of as many things as we can mandate. But I hope I get a minute to comment later on what the governor's done. But I'll save that for later if we get one more opportunity.
Go ahead.
Oh, okay, great. It's more related to the question about, how are we getting our work done, or how's it affecting our work? And to be honest, yes, it is affecting our work. We can't really have the work sessions we usually have, where we can sit down together and hash things out without making decisions in the public forum. Our work sessions are public, but we're not making decisions. So everything is slowed way down. But I do want to give the governor kudos, because she has really taken the heat off of us to have to do these mandates at the county level, for instance. And really, we've been able to push all of that negative stuff, and not intentionally, but it's all going to Governor Brown, and we can continue to get our work done, our day-to-day work that we need to get done. And we're not dealing with, at least in our county, we're not dealing with citizens, angry at us because we have, and I will say that we got very close with the Delta surge when the governor wasn't putting in a mask mandate, and she was kind of waiting for county commissioners to do it. And I think our health officer was very close to pulling that trigger. And then the governor the very next day came out and did the job for us. So kudos to Governor Brown for taking the heat off of us, and so we could get our work done.
Do you anticipate staffing shortages from people who quit because they won't get the vaccine?
There might be a few, but if we look at what's happened nationally, we're starting to see some data on that. We're doing okay, and there's just a lot of threats, a lot of drama. But when the rubber hits the road, like I said, listen to what folks say, but watch what they do.
Okay. Dr. Phillips, can you respond to the question about the governor's requirement for vaccinations? How that is?
I'm absolutely. So thank you for the question. I think that, the data has shown over time that mandates work, and things right now are just a lot more exciting than they used to be. But as I said in my introduction, You know, vaccines are boring. Mandates are boring. We've had these mandates throughout, you know, decades in every state for kids. You know, there are mandates to be able to go to school. We know that when employers request or require that their employees do things, that they do them. I do have some fear, narratively speaking, that there may be some, like, you know, flashy and erroneous arguments made that a lot of people are leaving their jobs in the healthcare field because of, you know, the mandate. I doubt that there will be data that shows that it's significant. There are many things happening at the same time right now when you look at the healthcare field. I mean, if a traveler can make 2 to 3 times as much, if a nurse can make 2 to 3 times as much money as a traveler in a different institution, is that the reason they left, or is it really the vaccine mandate? You know, fortunately, I think federally there is, you know, the mandate, so people can't just move to a different state. And once you start to get that even playing field, you know, there's not really a way to get away from this at some point. So I know that they work. You know, it was published here in our local newspaper that our school system, the Salem Kaiser School District, I think 90+% of their employees, 91 or 92, had completed all the either the exemption or the vaccination. It was around 90% that were vaccinated. And, you know, in the Salem Health, they've reported to the public news that 99.6% of medical providers are vaccinated and 90% of staff are vaccinated. So, I mean, I think that this adoption will just continue. Those numbers will go up, you know, as we get closer to November 30th. So I'm very grateful that, you know, as was said earlier, that the governor took the life-saving action to get us to a better place. You know, I've said previously in groups of friends that I think she will go down as having saved more lives than any governor in the history of Oregon.
Thank you. Dr. Gilmore, you were nodding. Do you want to
Yes.
weigh in on that?
Yes, I would agree completely with that. And actually, the mandates were, I think, enormously successful in our area. And I say that for a number of reasons. One is I've been working in the vaccination clinic for Sante and giving vaccines to employees that were initially reluctant, and they came rushing in to beat the deadlines. Sante itself said that the deadline, anyone that hadn't been vaccinated or had the very few exceptions, there were very few they allowed, was not going to be able to work Monday, this past Monday. And so they got up to, I think it was 88% of employees were vaccinated at that point. And they had actually demonstrations Sunday by some of the holdouts, plus these anti-vaxxers that came in from Ashland against the hospital, which was terrible for the staff trying to work through these cordons of angry people. But the hospital itself made a lot of sort of advanced preparations for this, and they actually had to close down some services temporarily. The urgent care was closed down. Some radiological services were closed because they didn't have, at some facilities, didn't have enough techs that could be running MRI machines and so on. So they consolidated some of those services. The cath lab, one of the cath labs had to be closed. So there definitely was some attrition there that the hospital anticipated, they kind of build into the system. Now, my wife actually was admitted to Rogue Valley Hospital 2 days ago, and she's there right now. And I haven't seen really any diminution of the quality of care there, which is surprising. I expected that, but actually the staff that's there, you know, actually are happy not to have unvaccinated people around them. And they openly express that. They feel safer, and the patients feel safer. So I think it really has worked very well for us. And we'll just have to wait to see long-term how some of these services get revived. I'm sure they will, but it's going to take a little while to do that.
Representative Dexter, I want to ask you that question, but also add from the chat, there are some discussion that the governor needs to do more to enforce mask mandates and actually arrest and fine people and make sure that this is enforced. What do you say to that?
I'm going to take the other part first because
Okay,
I do think the mandates are clearly working, and Kaiser Permanente has done a fantastic job in the past with vaccinations, and so we kind of came out of the gate. We are not losing our workers for the most part. The vast majority are vaccinated. The folks that we're leaving behind are the ones that I am most concerned about. Those are my patients who have immune disorders, who can't, even with a vaccine, protect themselves. So it is the community taking that on that really is important. And we see that with Colin Powell, who couldn't protect himself even with the vaccine. Our adults in custody who are being watched and taken care of by 50% vaccinated officials in our prisons. And we know that there's been enormous breakthrough infections in our state prisons. And so the vaccine mandate, I think, is critical because this is a population who really aren't taking precautions to protect the people that we've put in custody. And as a state, it is our duty, if we put someone in custody, to keep them safe. So I do 100% believe in the mandates and that they will work. And frankly, you know, I do have dismay about people who leave healthcare at this moment in time. And yet we need people who believe in science and are willing to protect our patients serving. So I'll leave it at that. I want to also raise up Governor Brown's action. She has taken the heat for local electeds over and over again, including myself on down. And it's a thankless position that she has been in, and she has done it with resolution, with resolve and persistence throughout. And so to get to the point where we're saying we need to do more, I don't disagree with that. And yet I think we also can take local action and deal with our communities and the people with whom, you know, we live in neighborhoods who are also part of this issue, you know, asking questions about, you know, each other and what actions are you taking to keep each other safe. Doesn't have to be loaded with, are you vaccinated or why aren't you wearing a mask? I just think that those interpersonal conversations, I'm going to go back to that first point, that it is the one-on-one conversations with trusted people in our community that change minds. And each one of us has the ability to change minds. We can all look to the governor to enforce it, but we don't have the ability to deal with the gun violence issues and all the things in Portland, let alone send out officers to enforce mask mandates. So I think we need to recognize that we all can pitch in and be a part of the solution. So I'm not going to point fingers at Governor Brown. I think she's done an amazing job.
Thank you. Marcus, how about at the school board with the teachers now required to be vaccinated? How will that impact staffing and your work in the schools?
I think it's the teachers did a wonderful job. I think we're holding to go take a step back. Our operations department and superintendent did a phenomenal job. What they did is they had their managers of their various departments go and talk to the various administrators and to teachers who put in exemptions, who were reluctant to be able to do it. And like you just mentioned, the one-on-one conversations were a lot better when they were in their groups. Because once you get a one-on-one and you start having those candid conversations and honest conversations, you find out that many of the things they were concerned about were things that we could work with. So that allowed us to be able to get more teachers vaccinated, and we only had 15 people who actually decided to not actually get vaccinated. We had, I believe, 20 exemptions for religious reasons, and we had 18 for medical exceptions. So we thought that was phenomenal to be able to take the time to reach out to those people one-on-one instead of trying to do it as a group. And I think that gave us the opportunity to find out more things that we need to continue to keep working on. So I think it's going to continue to allow us to not only engage with the students and continue to keep moving forward. I think it gives us the opportunity to find, I said, things that we need to work on now in the future.
Okay, thank you. So we've reached the end of our question and answer period, we've actually reached probably the most important question. I want to give each of you a chance to close, and I'd like you to include in your statement how we as activists can support your policies to control the pandemic. You've all talked about one-on-one conversations in your communities and with community members or schools or parents. What can we as activists do to facilitate that understanding out there? And I'll start with you, Dr. Gilmore. You're muted. Doctor, you're muted.
It briefly unmuted and
No,
you're.
I've got it now, because what happened is all the images went off and I went off Zoom there, just as you're asking me the question. So I was just frantically trying to get back on. I think at this point, what the activists could do that'd be the most help is support the people in our schools, our hospitals who are still working there, who've been vaccinated and are wearing masks and trying their best to stay safe, despite all those terrible forces outside the environment. So anything we can do to support them, but publicly support them, and counteract the craziness that's going on with the demonstrators, the anti-vaxxers and so on, that'd be very helpful.
Thank you. Dr. Phillips?
Yeah, absolutely. I mean, my simple answer is vote, volunteer, and support good leaders. It makes a tremendous difference. I know here in the Salem Kaiser School District race that just happened, we were able to get a new majority and kind of a historic new majority in our Salem Kaiser School District. And the closest race, we won by 71 votes. So, you know, every vote matters, and it's going to be an interesting 2022. So, you know, getting background knowledge, you know, showing up at stuff like this, writing letters, but at the end of the day, voting and volunteering makes a huge difference.
Thank you. Kathy Schwartz.
Thank you. You know, I think what the most powerful thing activists can do is show up. I think sometimes folks don't realize how powerful citizen activism is. We used to have maybe 3 people show up to our county commission meetings. With Zoom, that has certainly increased, and with people's interest in COVID, we're seeing closer to 30, 40, 50, sometimes 60 people on the Zoom call, especially around the COVID issues. But it really goes for all the issues that are important to you. It is really just to show up and talk to us as county commissioners. You'd just be surprised how little we hear from people. And so show up, vote, pay attention, like Dr. Phillips said, who's on the ballots, you put the right butts in the seats. You know, I really think that's just critical to get activated in that way. So I think, yeah, thank you.
Thank you. Marcus LeGrand.
Yes, I think I want to say first, thank you for allowing me to be here tonight and allowing me to be able to speak on what we're doing here in Central Oregon. And I just want to thank everyone for all their courageousness who are fighting not only this pandemic, but fighting the many issues that are coming to the forefront that you never had to deal with before. Let you know that people are out here supporting you and continue to look for those places, those people to keep you grounded and to keep you safe. But one thing I would say I want activists to do is this: be informed, interrupt. Please interrupt when you hear misinformation, and you don't have to be forceful about it. Just, you know, interrupt misinformation. When you're at the dinner table, when you're at Thanksgiving and you have that one person who you know is going to be a problem, interrupt them and make sure that you understand what's going on, but also be safe. If you have any disputes with people, be safe. Continue to, like I said, inform, put information out there that is relevant, and try to stay away from all the misinformation if you can. And also find some opportunities, hey, activists as well, find times to support many of your local leaders by finding an opportunity for to be able to praise not only what they're doing, but the collective is doing as well. And then also find ways to help them find wellness, because they need your support in that too. All right, so that would be something I would say the activists can do at this time.
Thank you. Representative Dexter.
Thank you. I think everyone has really articulated what we do need you to do. And I think I might steal Dr. Phillips's vote, volunteer, and vocally support good leaders tagline, because I think it's really important. I also want us to really make sure that we continue to encourage our neighbors to do the precautionary things that we know are most effective: vaccination, masking, distancing, not being afraid to have those conversations, and to show each other compassion. You know, there's a lot of identity politics and people taking sides, and this is a continuum, and there are really complicated reasons that people feel the way they do. So ask questions, listen to understand rather than judge, and try to continue to reach out to people who think differently, because I think right now our world just needs more compassion. Thanks so much for having me tonight.
Thank you so much. I want to thank all of you for taking the time to be with us and sharing this information. I know we're going to put it to good use.